We're so glad that you're here with us. This is a really welcoming space for individuals that are living life after a diagnosis of early stage memory loss or some cognitive changes. Sometimes we refer to that in this program as mild cognitive impairment. And this program is for you, your care partners, and we also host a lot of clinicians who support this population and community. And here at the Cognitive Empowerment Program at Emory, our mission is really to help people with memory changes to live well. We want to empower people to use information to live with confidence and get more clarity about this diagnosis. So each week we come together and really learn together about real life strategies that support brain health, that will support your independence. And we're really also thinking a lot about your emotional well being on this journey as well. So if it's your first time joining in this series, you're going to hear from a lot of our experts. We have everything from our registered dietitians to folks that work on movement, our exercise physiologists, and what our real goal is to share evidence-based tools, things that are supported and backed by research. I know a lot of times people go to the clinic and get a diagnosis of a little bit of change, and the first thing they want to do is get online and Google all of the different possibilities of, what to do next. It can be really overwhelming, and we know that when you come here to CEP Live, that you're coming to be with experts in the field who really are using research as the foundation to share here. So let's get into it. What are we doing this week? This week we are going to be talking to Dr. Sam Crowley, who's going to be talking a little bit about developing some strategies to make up for some changes in your memory. What we know working here at Emory with our folks every single day is that there's a lot that you can do to be proactive. Things like using a little calendar or a notebook in your pocket. And Dr. Crowley is an assistant professor of neuropsychology who's coming to us from the the Medical University of South Carolina. And he's going to be an excellent resource for our audience today. He's a member of the Alzheimer's Association International Society to advance Alzheimer's research and treatment. And so one of the things that he's really interested in is providing education about different diagnoses like this in the community. And at his clinic, he does neuropsychological evaluations to all kinds of different populations, but with a real focus on folks who have cognitive changes or changes in their movements in their body. So he's going to share a little bit about some of his research today, some of the interventions we can do to improve some of our conditions. So welcome in, Dr. Crowley. Will you tell us a little bit about today's session and why it might be relevant to the folks online with us today who might be experiencing some changes with their cognition?
Yes, thank you very much for that introduction. So today we're going to talk about some strategies that you can put in place to help with some of the memory changes that tend to come with mild cognitive impairment. So I know that a lot of times when patients come to see me and they get that diagnosis, it can be kind of scary and daunting because you really don't know exactly where to start. You know that maybe there's some things you can do to help. And I know that, most neuropsychologists try to spend some time talking about strategies in this feedback session once they diagnose, but that can still be kind of tough to take all that at once. So I'm hoping today I'm going to go through some of the things that I really commonly recommend to my patients. And I'm hoping you can kind of use it as a resource, come back to it for other ideas for different ways to develop strategies to help with some of the memory problems you might experience.
All right, let's get into it. And like we said, we're going to have this session recorded, so don't feel like as you watch today you have to take wild notes or remember everything that's being said. We'll post this session to our YouTube page, and all of our viewers can refer to it at a later time as many times as you'd like. So let's get into it, Dr. Crowley.
All right, great. So, again, I'm really excited to be here to talk about this today. There's a million things you can really discuss when you're thinking about how to help with cognition when you have mild cognitive impairment. And today I really wanted to focus more on memory because that's really what we think about when we think about MCI most of the time. So that's what I'm going to dig deep on. I'm going to talk a little bit about different theories of memory or one theory of memory and how we can build on that to create strategies. I'll then talk about a few different strategies that I usually recommend. And then I'm going to end by talking about kind of where to start when you're trying to develop strategies to hopefully give you somewhere to go here. Okay. So I wanted to start very basically with the question of what is memory? So memory is quite simply put the gathering of information, the processing of that information, the storage of it, and then the ability to recall that information later. So there's a few steps, but it's basically the ability to record information and then use that later when you're thinking. So there's different kinds of memory. Today we're going to be focusing on what we think of in neuropsychology as long-term memory, which is memory that lasts more than a minute. That's usually what we're thinking of. There are other memory systems that are shorter, but we're going to be talking about the memory systems that last longer, mostly because those are the systems that tend to be affected by mild cognitive impairment. So I'm going to give you a few different vocabulary terms here. Within long-term memory, there are a couple of different types of memory. The first of those is called explicit or declarative memory, and this is information that's consciously remembered. That can be very general information, who the president is, how to get from one place to another, but it's something that you have to recall up and then use in a task. So it can also be something specific. So, if you talk to your spouse about what you're supposed to pick up from the store, going to the store and then recalling that is part of explicit or declarative memory. And within explicit memory, there are a couple of different subtypes of memory. One of them is episodic memory, and that's memory for specific events and specific experiences. And again, this can be bigger things, remembering your wedding day, remembering something that happened when you were a child. But this is also, more specific stuff, trying to remember a conversation you had with your friend last week. So that's episodic memory, tied to a specific event. The other kind is called semantic memory. This is memory for general facts and concepts. So, remembering what kind of animals are mammals, remembering what the capital of Italy is, things like that would be considered more semantic memory, general knowledge. To make this distinction a little easier, you can think about it this way. The memory that Abraham Lincoln was the president of the United States during the Civil War is more of a semantic memory. But if you remember that you learned that in your eighth grade history class from Mrs. Smith, that's more of an episodic memory, right? So that's the distinction there. Episodics are more specific. The other kind of longer term memory is called implicit memory or procedural memory. And this is memory for skills and tasks and also memory for habits. These are things that you don't have to consciously pull up to remember. They're things that you can just do automatically without thinking about it. So as an example here, I'm going to read a description that I got from Google AI of a process that we all do every day. And I want you to try to follow along with it. Start with a basic knot by crossing the laces to form an X, tucking one lace under and pulling both tight. Next, create two loops or bunny ears and cross them over each other before pulling one loop through the hole to make the bow. Finally, pull both loops tight and secure the knot. So you probably caught on that that's tying shoes, but I've read this several times, and I still have trouble picturing that in my mind, right? But I tie my shoes every morning, and that's because that's kind of a procedural memory task. It's something that I just know how to do without having to consciously think about it. So I want to talk now about the different phases of declarative memory. And I want to focus on declarative memory because this is the thing that tends to be impacted in mild cognitive impairment. So the first part of declarative memory is encoding, which is just learning of information. I like to think of memory like it's a library, right? The books are all of the different information that you know, and the librarian is your memory process. So encoding is like the librarian that's your memory process, putting that information on the shelf and storing it. The process of finding its place on the shelf is called consolidation, and that's just processing memory. So you have learning the information and then getting it so that it's in the exact right place in your memory. Then you have retention, which is just keeping that memory stored effectively in your mind. And this can last anywhere from a few minutes to a few hours to a few days to your entire lifetime. That's what retention is. It's keeping the memory in place. And the last phase is called retrieval. And retrieval is pulling that information out when you need it for a task or when you're talking to somebody about something and trying to remember something. So this is like if you had your librarian, somebody comes into the library and asks for a specific book or asks you to remember something specific. Recalling is the ability of your librarian to know where to go on the shelf and how to pull that information back out to use it in a task or to give that book to the customer. So again, we have encoding, which is the process of learning information, consolidation, the process of getting it into storage, retention, the process of storing it for any amount of time, and then retrieval or recall, which is pulling that information out again. So different problems can happen at different phases with memory. And it's important to know this because it kind of bears on what kind of tasks are going to be more or less helpful when you're trying to come up with strategies. The first thing that can happen is a problem with memory encoding, which again is that learning of information. So trying to remember one bit of information is not too bad, right? Trying to get one piece into your mind, but that's typically not how information works. Typically, we have a few different pieces of information that we need to then sort and put into memory effectively. And that's a lot more challenging. So that's as if your librarian had several books instead of just one book. And what can happen when you have an encoding memory deficit is that a couple of the books go to the wrong place. A couple of them get to the right spot, but some of them maybe get dropped on the way to converting them to memory. Some of them maybe never make it out at all. And so you're not getting all of the information into your memory. So you never really have a chance to do the consolidation or to recall that memory later. That's an encoding deficit. That's not supposed to be there. The second kind of deficit is declarative memory the deficit called consolidation or retention deficits. So again, consolidation and retention are that middle part where you're kind of processing the information and storing it. But sometimes that information can disappear over time, and that's what we think of as a retention deficit. So that's like if your library had maybe water damage or there was something on the shelves that was affecting the quality of the books, so that at some point they just go away, right? So now you don't have all that information there because your storage system is not very effective. The third type is called a memory retrieval deficit. So again, this is that last part of memory, which is going into your memory and pulling information out. Memory retrieval deficit means that your librarian might be having some trouble knowing where to get the information from your library. So it's your mind doesn't quite know where the information is stored. It is stored in your brain, and we have ways of figuring out if it's stored there or not, but your librarian, it just kind of gets lost on the way to the shelf. So again, we have encoding deficits where we have problems learning information. We have consolidation and retention deficits, which is problems retaining that information over time, and retrieval deficits, which is problems pulling that information out again. Okay, so I think that's enough vocabulary terms for now. Let's go in and think about what are some different strategies that we can use to help us make up for some of these memory issues we might have. The first general principle is that it's important to try to deepen your memories by enriching them with more information when you're first committing that information to memory. So, uh, doing a little bit of anatomy here, this area here is called the hippocampus, and that area is important for consolidating and retaining information. And then you have this area in the front of your brain here called the frontal cortex. This is important for learning information. And these two areas work closely together. But if there's an issue in one area, what you can do is spend more time memorizing or learning and learning in different ways. And that'll give these two areas more time to talk to each other, which will help you get that memory into your mind more effectively. You can do that by using different memory systems, which we'll expand on here. So again, we're talking about the declarative memories affected. You can use the semantic system or the procedural system. You can also try using multiple kinds of memory at once or multiple kinds of information. So instead of just using verbal, try using both visual and verbal information. And by doing that, you're going to be using more of your brain, which will give you a better chance to get that stuff into memory. Okay, so let's get down to brass tacks here. That's enough theory. Uh, let's first talk about how to use semantic memory to help with your declarative memory. So I want you to do a little exercise with me here. The first thing I want you to do, I'm going to give you about 20 seconds, and I want you to think of as many words as you can that start with the letter B. Now keep track of how many you get. Ready, go. All right. So you got how that's about 20 seconds. Make sure you remember how many words you got there. And now I want you to do something similar, but instead of doing words that start with B, I want you to think of as many animals as you can. Again, I'll give you about 20 seconds. Keep track of how many animals you get. Ready, go. All right, that was about 20 seconds. Now, I'm guessing the majority of you were able to think of more animals than you were words that start with the letter B. And the reason for that is semantics. So semantic memory and semantics is the relationship between different concepts. So it is knowing that, for example, dog is connected to cat, which may be connected to other animals, right? So you have this web of information so you can jump from one to the other. Remembering one animal will quickly remind you of another animal, which will remind you of another, because all those things have related meanings or semantics. So we can use a couple of examples here. For example, I bet if you think elephant, within the next 5 words, you're going to think something like zebra or giraffe. And the reason for that is these are all very closely semantically related, right? They're all African animals. You'd probably be less likely to think elephant and then think something like shark because that's also an animal, but it's not as closely semantically related. This can be things like facts, but it can also really be anything. It's just any kind of meaning. So it can be something from popular culture. For example, if you thought lion, you might have followed that up with other African animals like elephant or zebra. You might have also thought tiger and bear. You might have followed that up with an oh my from The Wizard of Oz, right? So these are also semantically related. They're all related because they chant it as they walk down the yellow brick road in The Wizard of Oz. So now those have become semantically related because of uh, because of popular culture. So this can be used to kind of have a little bit more fun. The semantic relationships that you think of to help with your memory don't have to make a lot of sense as long as they make sense to you. As long as semantically you think it makes sense and it helps you remember, that's great. So how do we use this? How do we use semantics to help us remember information? Well, part of it is you can lower your memory load by clustering things semantically. One really good way to do this in everyday life is, for example, using a grocery list. So let's say you have your grocery list, maybe you have it on your fridge and you mark things down as you realize you're going to need them when you make your trip to the store this week. And that results in a pretty unorganized list here. What we can do is use semantics to cluster this information. So this way, it's a little bit easier to remember. Instead of having to individually remember milk, potatoes, soda, and so on, you can tell yourself, I know I need three produce items, two dairy items, and two beverages. And then from there, you're kind of giving yourself a little hint because you're thinking about what are the semantically related things that I'm pretty sure I need to get. And as long as you have a little bit of that memory in your head, it'll help you get to the right items. So it's just a way to take the load off. That's semantic clustering. The other thing you can do is use semantic associations to create an image in your head. And that can help you remember because again, trying to get that is the relationship between visual information and verbal information can help you to retain that information better. So let's say, for example, you're trying to tell somebody about a fabulous presentation you just watched by a professor at MUSC, but you can't quite remember what my name is. Well, you might remember that my name is Irish, right? My name is Crowley, so that's an Irish name. If you know that my name is Irish, one example of a picture you could put in your head is maybe me dancing an Irish jig. So then you can get that association, gets you a little bit closer to remembering my name. Something even more specific, because again, it doesn't have to be fact-based. It can just be something you might know from pop culture. Ozzy Osbourne, rest in peace, had a big hit song called Mr. Crowley. And if you knew that fact, you could create an image in your head of something like me performing on stage as Ozzy Osbourne to try to help you remember what my name is, right? So this is just a way of first crossing that verbal and visual information so that you're using both to store memory. And then also using semantics to remember relationships between different things and using them as a kind of hint for yourself. You don't have to have semantics to be related to mental images. There are other ways that you can do this as well. For example, let's go back to the grocery store, and you maybe don't have your list with you, but you need to figure out what produce you needed. And especially to store with a produce section this impressive, that's going to be kind of challenging. One thing you can do is when you're looking at your list at home, picture in your mind that you're walking through a garden and picking out all the different items you need, right? So digging up a potato or two, getting some tomatoes off the vine, maybe picking some cilantro. And by crossing that visual information and verbal information, that's again going to help you remember that a little bit better because you're spending more time with that memory. You're letting the frontal part of your brain and that hippocampus part of your brain bounce back and forth more. And that's going to help you remember things a little bit better. Another thing that can help you with memory is creating relationships between things that weren't there before. So this is kind of related to semantics. One popular way to do this is by using face name associations. So this is actually from an intervention that was developed at Emory. And this was an exercise where people had to create a relationship between somebody's face and their name by using cues that they came up with themselves. And these are just a couple of examples here. So you have this gentleman on the right who has a rather large mouth. I always thought this example was a little mean, but you could picture him yawning very widely. And then your verbal cue that would get you to yawn. And then you'd remember his name is Sean. So again, just giving yourself kind of mental breadcrumbs as you go. The other example here, you have a woman with clear, clean skin that's very smooth on the right, as if she just got a facial. So then you can remember facial rhymes with Rachel. So that can help you get to her name. So face name associations, they can be rhymes. They can also be things like those examples I showed where you're kind of just using relationships between different things to get to that memory. But the key is that you're just giving yourself more time to think about it. You're giving yourself more relationships to build off of. Another thing that you can do to help is create a mental story in your mind. Maybe you're not a very visual person and you want to uh, use more verbal information instead. Well, that's also something that works quite well. So let's go back to our grocery list. We again have those same 7 items. One thing that you could do to try to remember them is just create a story in your head. So uh, he dug up the carrots and potatoes to add to his broccoli quiche, but then realized that his cheese was moldy and his milk had gone sour. He was so upset that he replaced his soda with wine to calm himself down. So here, you're creating this narrative, and that's going to help because you're setting yourself with hints as you go, right? I know that he was digging in the garden, so it's got to be something that's some sort of root vegetable. Broccoli is a common quiche type. Cheese and milk is something you need to go into quiche. And then soda and wine are just the two beverages. And so when you're doing this kind of story, it helps if you can set yourself some hints, right? So the cheese is moldy, milk is sour, right? Digging up with carrots and potatoes. If you can set yourself those hints, this will work a little bit better. But it's just another way to give yourself those mental breadcrumbs and that information so you can remember it later. Okay, so these are kind of some general strategies. You might be asking yourself, do we have any evidence that this stuff actually does anything to your brain? And the answer to that is yes. So also from Emory, there was a study using that face name association exercise that I showed you before. And what they did is they trained people with mild cognitive impairment on how to do this exercise. And then they put them in an MRI scanner and they measured their brain activity. And they compared brain activity before and after learning to do this exercise. And here's what they found. So on this diagram here, this is the front of the brain. You can see the nose right here. This is the back of the brain. Okay. And these red spots are areas where there was more activity after the exercise had been learned, and they had to do this exercise in the scanner. We know that this area here is important for attention and focus, okay? And this area here is really important. Again, that's that part of the brain that kind of communicates between the frontal part of the brain and that memory part of the brain. So and then this is also an area that's important for memory. So these are all areas that were more highly activated. So by doing these exercises, you're actually lighting up more parts of your brain, giving yourself more time to remember that information. Okay, so those are things that are more related to relying on semantic memory. But sometimes people have trouble with semantic memory. That is something else that can be affected in mild cognitive impairment. And so it helps to also use some other kinds of strategies. And the other kind of memory you can rely on is procedural memory. So again, procedural memory is that ability to learn information and then have that information be automatic. Tying your shoes, riding a bike, um, things like that, right? And there's a reason why this is a particularly effective strategy for people who have mild cognitive impairment. So, as I mentioned before, here's our old friend, the hippocampus. This area is usually affected by mild cognitive impairment. We have this frontal area here, frontal cortex, that can also be affected by mild cognitive impairment. But we also have this purple area right in the middle here. And this area is called the basal ganglia. It's right in the core of the brain. And the basal ganglia is really important for procedural memory. Procedural memory goes more through the basal ganglia than the hippocampus or frontal cortex. And the basal ganglia is usually not affected by mild cognitive impairment. So, for that reason, the procedural memory tends to stick around, whereas declarative memory tends to decline with mild cognitive impairment. So, what are some different ways that we can use procedural memory? Well, really, it's just about trying to create new habits that can become automatic over time. So, one example of this is using a memory box. So, you can, for this, you can just place a moderately large box in a frequently passed location. Something like a front door is usually a great one. Somewhere in your living room, in your bedroom, something like that. It should be really eye-catching, like this beautiful pink sparkle box that I found on Amazon. Um, and then you put all your important objects in that box without use when you're not using them. So you walk in the house when you get back from being out. First thing you do is just put your keys in the box, put your phone in the box. Anything that you frequently end up losing, just put it in the memory box when you're not using it. This is not something that'll happen right away. It is most of procedural memory does take time to start. But the idea is that over time, you'd get used to putting things in there. And then every time you lose something, first place you check is the memory box. Did you check the memory box? Because that's the first place that you go, right? You can also use this, as was kind of mentioned a little bit at the beginning, to create a calendar. So make a calendar, make it really big. Usually, like a nice whiteboard calendar is really nice. Make sure it has individual days of the week and the whole month. Make it like a dry erase calendar. And then again, place that in an area that you walk by a lot in your house. And make it a habit of checking that calendar every single day, right? So you wake up, brush your teeth, and right before you leave your bedroom, you just look at the calendar on the side of the wall and say, what do we have planned for today? By doing that, again, making that part of your everyday routine, it'll be a little bit easier over time that'll just be part of your day. Brush teeth, check calendar, leave the room, right? Um, and if you are able to make that a habit, it can help you stay on top of things like appointments. Things like reminders and calendars can also be helpful, but because they're in your pocket most of the time, it's kind of out of sight, out of mind. It can be easier to get in the habit of using something like a whiteboard calendar. Something else that can be helpful is something like a personal notebook. So this should be small enough that you can kind of carry it discreetly, either in a pocket, in your purse, something like that, and just get in the habit of jotting down important information. Now, this is one that does take a little bit of practice to get used to because I know a lot of us don't really use notes that often unless we have to. So this usually takes a little bit of trial and error of figuring out what information do I usually forget that it would be helpful to put in here. What are the different important ways that I can do this? What are the good keywords that I can use that'll help me remind me of some information? But again, if you carry this with you all the time, and every time you know something important is about to be said, you whip it out, over time, that's going to become more of an automatic process. You don't have to rely consciously on remembering that information. The other thing that can help is just pasting instructions for how to use an object. And this is going to help you kind of learn as you go, just having that present next to the object. Usually easiest if you paste that information on or near the object to facilitate its use. So again, what we're trying to do here is just creating more of those habits, more of that automatic information. One last thing, as far as making things automatic, it can be really helpful to keep your schedule nice and consistent. The reason for that is this will become more automatic. A lot of these things become stuff you don't have to think about. So keeping your sleep time and your wake time really consistent, just making sure that we go to bed at the same time every night, we wake up every morning at the same time, because then that's not something we have to worry as much about. Keeping activity consistent from day to day, and at the same time every day, because that will help it be more automatic, right? So, for example, If we know that we have to walk every day, and it is usually recommended by doctors to walk, right? We do that after breakfast every single morning. Breakfast is at 9, we walk at 9:30, right? So over time, that'll just become part of your habit, part of something you do every single day. And by making sure that it doesn't vary that much, this will be a little bit easier to just do automatically. It's helpful to plan breaks. You don't want to over plan in this situation, right? You don't want to be exhausted by the end of the day. It's okay to have those breaks and try to make minimal changes week to week because, again, the idea is to keep this as automatic as it can be. But you should also create some room for flexibility. Uh, every few weeks, think about what are the things that have been working that we've been sticking to. What are the things that are not working as well? Maybe we should take more breaks. Maybe we should be taking less breaks. Maybe we should switch up activities that we're doing. But all that kind of stuff will help if you can keep this sort of thing consistent. So the I want to kind of start finish up a little bit here with talking about um, the biggest takeaways from this program. So memory problems can be due to a couple of different memories issues, usually either encoding and retrieval or memory retention. Again, that's learning information and pulling it out or retaining that information over time. Problems with encoding and retrieval, those are the ones that usually benefit from engaging your brain a little bit more. So using those semantic clustering strategies, visual imagery, word associations, creating a story, all that stuff is going to give your brain more time to learn the information and get it into your memory, and also help give you some kind of breadcrumbs to pull the information out later. Sometimes those don't work as well. And in that case, if you have more of a problem with retention, keeping things more automatic by having a consistent daily routine, using consistent rules for something like memory boxes, creating those habits is going to help with day-to-day issues. Um, it's really important to try to employ a lot of these things as early as possible because it does take some trial and error. So kind of getting used to developing those strategies is going to help you as you age. If your cognition changes, it'll help to keep these processes in place if you're used to using them. Okay, so I know that was a lot of information, and some of you might be wondering at this point, where should I start here? The and there's a couple of different things that I recommend as far as steps. The first thing that you should do if you haven't already is request a neuropsychological evaluation. This is a little bit of self-promotion, I guess, but I do think that having a neuropsych evaluation can be really helpful. What neuropsychology does is we do really thorough evaluations of your thinking, and we can pull apart different parts of thinking to see exactly what types of problems you're having, right? Are you not remembering things because you're not learning them or because you're not retaining them? Are there other things going on that are affecting cognition? Um, and these neuropsych appointments are really the best way to do that. They're typically a lot longer. We take a lot more time than a neurologist is able to do because they're so busy. And so we can really dig down deep and figure out what's going on with your cognition. After you get that evaluation and you get the feedback and they give you all the information, consider what areas of memory and thinking are impacted right now. Is there a problem with encoding and retrieval? Maybe you can start with those semantic strategies, those mental image strategies. Is the problem more with retaining information? Maybe try relying more on your procedural memory. Are there other areas of thinking that are affecting the ability to create these strategies? Is problem solving impacted right now? Are you thinking slower? Are you having trouble maintaining focus? All of these things don't mean that you won't be able to use these strategies, but they do mean that you might have to think about how to adapt to those things to start using these strategies. These are all questions that you can ask your neurologist, that you can ask the neuropsychologist. Usually we give a feedback at the end of your evaluation, and any neuropsychologist would be happy to help you understand how to start using these strategies. The next thing that can be helpful is try to applying different strategies. So, don't be discouraged if one of them doesn't work. Try something else. Really think about why a strategy is not working, and if that can inform the next one you try. And you can also try learning these strategies together. I know that I've used some of these, and they really help me with my memory. It's helpful for people with MCI, but it's also helpful for their partners, for anyone else in their life to try to also learn these strategies together. By doing that, you can also kind of get some insight as to what the issues might be, and where the challenges are with using these strategies. The last thing that you can think about, if it is a little bit overwhelming, is to try using cognitive rehabilitation. So, consider using this is typically done with a speech pathologist or a neuropsychologist. And this is basically what this does is every week, every week you kind of talk about what strategies have been working, which ones haven't. They spend an hour with you kind of going over and learning new strategies. So this can be something that's really helpful as well. I just realized I've been doing this the wrong way the whole time. I apologize about that. The last thing I wanted to mention is just that developing these memory strategies is a journey. So this is something that it can be that a strategy works sometimes and not other times. You may be better with strategies at some points and struggle with them in others. You may find that something is helpful some days and not others, even depending on things like your energy level. And that's totally okay. Learning these new strategies is something that's just part of this condition and kind of part of the journey of it. Okay, so thank you very much for your attention here. I'm ending here with one last mnemonic strategy. This is my cat Sid, and she's named after Sid Vicious because she's kind of crazy. So one way to remember her name is to think of her as kind of a punk rock cat. All right, so thank you very much for your attention.
Thank you so much. That was a really nice overview and a lot of encouragement to get some of these systems in place early. And that's what we, encourage folks every day here at our clinic too, is that the sooner we get some of these routines of having that memory box or having that calendar on the wall implemented, a lot of times the easier it makes the journey ahead, and it can help lift some of these stress levels that we might be experiencing every day. And I'm really interested, Dr. Crowley, when we talk about working with a neuropsychologist, can you speak a little bit about how working with a neuropsychologist or even going through a rehabilitation program can really help people to identify their strengths?
Yes, absolutely. So part of neuropsychology is understanding where you're struggling, but certainly a big part of it is also understanding what areas are strongest. And that is because those are the things that you can also lean on when you're trying to learn some of these strategies, right? So if focus is something that you're really good with, that can kind of help us to know that that's not something we have to worry about as much, that you're going to be able to retain that focus. One thing that I am very encouraged by when I see a patient, even if they have some memory issues, if they're executive functioning, so problem solving, kind of mental flexibility, if that's a strength, that's awesome, because that means that they're going to be able to do what you need to do with any of these strategies, which is learning how to use them effectively and kind of troubleshooting as you go. So yeah, the strengths is definitely a huge part of it.
Yeah, it's one of the things that can be really empowering is to go work with a professional who will put you through a series of things like pen and paper tests. It's really not that overwhelming to kind of go and get some of these evaluations done. It can be a little bit of a challenge. But one of the benefits to that is really understanding what your strengths are, feeling confident and good about those, and then finding ways to implement some of these strategies in some of the places that you might be challenged. Like, let's say if you're having a hard time remembering your schedule on a day-to-day basis, instead of going to your wife 4 times a day and saying, hey, what are we doing today? What are we doing today? What are we doing today? Having that calendar on the wall in the kitchen with, what's happening today, or having that, alert on your phone with the schedule for the day in it can really help to, almost even sometimes maintain relationships and communication a little bit as well. Like you said, especially when we're working together to get a system in place. So we find a lot of people, whether you're a care partner of a loved one that you live with, or whether you're an adult child helping out a little bit with your family, that a lot of these systems can help to preserve not just your independence and feeling empowered along the way, but help to preserve the relationship as well.
Yeah,
So we've got
definitely.
We've
And
got a lot of thank yous in the chat. There's a lot of different systems that you guys can use. One of the things that we encourage here at CEP is considering the use of technology a little bit in the journey. Dr. Crowley, anything you've seen as far as using things like Google Homes or alerts or reminders or things like that that you've seen be successful in clinic?
yeah, I mean, using all of those kind of newer items, it's really nice that everything's voice activated now because it means you have to spend less time kind of fiddling with stuff to do things like set a reminder. Um, I know that I use one that I use a lot of the notes apps now will do kind of automatic categorization. So that example I was using for your grocery list, the notes app in your iPhone will do that for you automatically. And I use that all the time because I'm one of those people that needs that semantic clustering. So definitely, I think kind of voice activation technology has been really helpful, and just trying to find things that can help you with facilitating some of these strategies, especially stuff like semantic clustering can be great.
So get a little creative as you're coming up with some of these strategies. And along the way, I want to encourage everybody to work with someone like a neuropsychologist or one of those speech therapists to develop systems. We also have a lot of great occupational therapists that can help with these systems. But just to consider in the new year, in 2026, are there some areas that your household could use a little bit of support? Again, a lot of the systems we're talking about are not just for people who have challenges with memory. They are for everyday use, especially for people like care partners that might have a lot on their plate. Some of these systems can help kind of lift up some of the responsibility of remembering everything all the time. And what we know when you have that diagnosis of some memory challenges is that not worrying about all these little things can also free up some space for a little bit more clear thinking along the way. So something to consider. Dr. Crowley, thank you so much for sharing this week. We are going to share this video on our YouTube page in the next few days, and so that'll be available for anybody to come back to. But feel free to look back in some of our other sessions. We've got some other great ones that Dr. Casey has done about getting some of these systems in place that we'll share in our January newsletter. So we will see you all next week to do a little bit of getting active with Iotoni. We'll have a little bit of an accessible workout that also includes some really good brain workouts and brain challenges with dual tasking. And hopefully we'll see you all back next week. If not, we'll be back in January on the 6th. And we're going to be talking in January about how next year all of our CEP lives are going to be themed around the Lancet's 14 modifiable risk factors, things you can do every single day to preserve the memory you have now as long as possible. So we'll see you guys all back next week, and otherwise enjoy the rest of your Wednesday, and here's to kicking off the holiday season. Thank you all so much. Dr. Crowley, thank you for sharing all your expertise. We appreciate your time today.
Yeah, thank you very much for the invite. I enjoyed it.
All right, see you all next week, everybody.